Hello, everyone. It's Monday, May the 4th, and this is our briefing today. You know, we always are worried as we go through the weekend and everything because we're away from you a couple days, and we did have 3 additional deaths that came in on Friday, I think, and they're our 48th, 9th, and 50th death. Again, I want to caution everyone, let's don't become, calloused about the fact that the numbers are good and these people become statistics. One was a 79-year-old male in Kanawha County, a 69-year-old female in Kanawha County, and a 100-year-old female in Monongahela County. And bless all their hearts in every way, especially this wonderful 100-year-old lady, but all of them. We lost a man at age 70, way too young, and we lost a female at age 69, way too young as well. So please remember these people in your thoughts and prayers, and all their family and all their loved ones, and we're just going to, the good part about this, if there is any good part, is I'm not exactly sure if these deaths came in on Saturday or Friday evening, but we did not have any deaths yesterday, hallelujah, and we have not had any that have been reported today as well. So let's just hope and pray that we get through this blitz of nursing home situations, primarily where we have a lot of people that have been really sick, and so that's why we've had a continuing climb of a death toll. But nevertheless, in moving along, I do have to tell you that today at 1:30, I'm back on another call with the vice president, and so we'll have to cut this thing off just a few minutes early for me to be able to get to that. And so I'm going to go pretty quickly, week 2 starts today, of West Virginia Strong, the comeback, and again, we will be allowing to open and not requiring to open. Week 2, the Safer at Home order is also in effect. The order strongly encourages all West Virginians to remain at home, but no longer orders them to stay at home. Again, I encourage all businesses that are allowed to open to do so only if they can follow the guidelines to keep West Virginians safe. We continue to work with businesses to help them to establish protocols, and you should continue to stay home if you have any symptoms whatsoever that could be related to this virus. Now, I always want to read to you just a very little bit. Now, from my heart, I would tell you again, this disease is still with us. It is here right now. And absolutely, you should take all the caution in the world, especially if you're in excess of 65 years of age, or you're older than 50 and you have certain chronic problems. The other thing is, I would ask you to take care of your loved ones that are of those ages, especially, and use just good sense all across the board. If you happen to go out to a store and you're in a crowded store, please wear a mask. From the standpoint, if you're an elderly person and everything, and we know churches are going to have worship services and everything, and we know we're going to be on every other pew and we're going to be wearing masks and everything, but you're an elderly person and you may want to consider just waiting a couple of weeks. Things are really getting better. Today, I want to announce this, that again, we didn't ever get anything but dead last before. Today, West Virginians, because of you, again, I think yesterday, we were the first in the nation with the lowest rate on the R naught, category that basically says, what is the transmission rate of a person that has this infection? How many people can they infect, or how many people are they infecting? And we had the lowest in the nation, which meant we were the first in the nation. I think, since that time, Alaska and Montana had a better day than we had. Maybe we were the lowest on Saturday, but now we're third in the nation with the lowest rate, which is really good. Over the weekend now, we have trended to where our overall cumulative rate is 2.27%. It just keeps going down. That can't keep going down forever, but that's a great number. On Sunday, our positive growth rate was 1.9%. Again, in the ones, really, really good. I guess on a Saturday or something right before that, we had a really relatively low number of tests come in, and we had a little blip to the upside and everything, but since such a low number of tests, it was insignificant. I keep going back to just this. I'll tell you this real quickly, but just imagine West Virginia is at 2.27%. The national average is at 16. Virginia's at 17. We're at 2.2. Pennsylvania's at 20. Ohio's at 13. Maryland's at 19. And Kentucky's at 8.5. You really have done an amazing job. Week 3 will be, the week three of the reopening plan will begin next Monday. The businesses reopening for week 3 will be announced soon, and guidance for these businesses will also be released soon. In just a few minutes, Dr. Slimp and maybe Dr. Marsh are going to tell you about this, but I want to announce it just real quick. Today we are removing Cabell, Wayne, and Wood counties from the hotspot county list. And Dr. Slimp and Dr. Marsh have consulted with their local health departments, and I think they have a new methodology that they want to discuss, and I'm going to let them discuss that with you and everything. We have 5 counties, Marion, Berkeley, Harrison, Jefferson, and Monongahela, that are still on the hotspot list. Secretary Crouch is going to be going through some things on the nursing homes. Primarily that effective today, we are approving a $20 increase in with all the nursing homes. That's a federal deal. As far as feeding our kids, Clayton Birch is going to, be able to tell you some more about this, but the United States Department of Agriculture has approved West Virginia's application for pandemic electronic benefits transfer cards to support children's nutritional needs through the summer. And this program is part of the CARES Act, and Clayton Birch will tell you more about that in just a few minutes. But there's more than 231,000 children in the Mountain State that are eligible. It's unbelievable. That's all there is to it. I just got a couple other things. Workforce West Virginia will begin paying pandemic unemployment assistance benefits on Friday, May the 8th. And these are the self-employed and everything. And so that's good stuff. Now, I want to brag just a little bit on workforce. We got behind. Every state got behind. We got jamming, 10 things into a 1-part bottleneck, and we couldn't get it through there. And what did we do? We tripled the number of people that were pushing it. And then that didn't work. And so we tripled it again. And then all of a sudden, we cleaned up the backlog. You've got to know just this, that West Virginia was the first state, and I want to read this to make this right, the first state to provide the additional $600 additional benefit from the CARES Act. West Virginia is not now with people standing all the way around the block and down the street and everything with people just trying to get in an office to make an application or whatever. There are other states, lots of states, that have struggled with this in lots of ways, and we surely wanted to do better. And your governor has pushed these people beyond belief, but your governor also recognizes the good that they've done. And so I know I can't ask you to be patient because I don't want you to be patient. If you haven't gotten your payments or you can't get people to answer the phone, I don't expect you to be patient. You know, I'm not going to ever ask you to be that. I'm going to expect you to be frustrated and push us, and we'll push them. But I want you to know just this. They have done a lot of good work, and I'm proud of them. The last thing is this, and I haven't mentioned this the last time, but this you have got to do for me. You've got to do this for me. You've got to take seriously the census. You've got to call one another and make sure that you're counted. I mean, it means so much to West Virginia's future. That's all there is to it. You know, it absolutely will mean so much as we go forward. And the last go round for 10 years, we didn't all get counted. We didn't get the monies that we could have gotten, and it hurt us. So please, please, take heed. And if you absolutely want to do something for me, call neighbors, call your friends, call everyone and ask them to get involved. Ask all West Virginians to get involved to make sure we're all counted. That's all I've got for today, but we'll move on.
All right, thank you, Governor. Let's now go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slim.
Good afternoon, everyone. I have a couple of things to report on. Let me talk about the nursing home report quickly. We're still waiting on some data. Some of these reports are coming in a little slow. We want to make sure we have all of the information. So the last few facilities that we've tested, we still don't have all of the information. We will report on that this week as soon as that data is received and complete, and we can compile that. Either Kathy or Dr. Slimp or I will report on that later in the week. Governor Justice mentioned the nursing homes, though, in terms of the analysis or the reports that we've done and the testing that we've done. And we want to thank them again. The CEOs and the staff and the owners of these facilities have been outstanding, and the staff should be commended. They're just terrific in terms of going into those buildings every day and taking care of folks. The governor mentioned the $20 a day increase for nursing homes in West Virginia. That information is being sent out to everyone today. Medicaid will submit an emergency state plan amendment to increase those rates. That will be, in effect, $13.6 million additional dollars that go to the nursing homes, and we're making that retroactive to February 1 of 2020. So we'll have more information on that as soon as we communicate with CMS on that. Let me mention Children's Mental Health Awareness Day. Governor Justice issued a proclamation recognizing today, May 4th, as Children's Mental Health Awareness Day in West Virginia. This is to increase public awareness about the needs of children with serious mental illness and severe emotional disturbance and their families, and encourage those who need help to seek treatment. West Virginia is one of a fairly small number of states that requested and sought an SED waiver through our Bureau of Medical Services. That waiver has been in effect now for several months, so we have more capabilities than previously to take care of children with serious emotional disturbances or disorders, and we're happy to do that. We offer several behavioral health services for children and families. And while social distancing with COVID-19, community-based services may be offered remotely through telehealth. So please don't hesitate to contact our offices or the local behavioral health providers in your community to seek services. Children and families can find more information on these services and learn about coping with behavioral health challenges of COVID-19 at coronavirus.wv.gov or on the behavioral health page of DHHR. Want to also mention, and I'll keep this brief, but hunger is a threat facing many West Virginians, and one we work daily in partnership with the National Guard to try to prevent. Governor Justice mentioned that the United States Department of Agriculture and Nutrition Services has approved a joint application between DHHR and the West Virginia Department of Education for pandemic electronic benefits transfer. Those efforts will align with the governor's commitment to keep children fed when schools are closed. This card can be used everywhere that SNAP EBT cards can be used, and we will have a better timeline on that shortly. Finally, let me mention that delivered the national or strategic national stockpile medications to hospital pharmacies in cooperation with the West Virginia State Police. So that is a benefit to try to get more medications out to hospitals. And we're collaborating with the Department of Education to assist needs at food manufacturing plants. So we're looking at those as well. So that is all I have today. Kathy?
Certainly. Good afternoon. The governor referenced transitioning to a new methodology that is a kind of database methodology for alerting communities when they may be seeing increased risk of transmission in their communities. We have been working really hard over the last few days and over the weekend to finalize that methodology and to gather input from partners on the same. Just time-wise, we will not spend a lot of time on it today, but I anticipate rolling that out more fully on Wednesday as we transition into that methodology, probably beginning next week. But we'll discuss it in the middle of the week, Wednesday or so. The other thing I wanted to touch base on today, and we continue to hear from communities, is just the importance of recognizing that we are all really excited about reopening and accessing services that we've not accessed for some time. And it is critical and important to make this move, but it's also really important to not do so simply going back to normal. That we really have to be cautious and disciplined with this reopening. And recognizing the impact that doing so too rapidly would have on our communities, especially on our vulnerable populations. We could definitely see increasing rise of disease if we do this too quickly or not in a disciplined and cautious approach. So that really reemphasizes the fact that, again, public gatherings, even though they are 25 or in hotspot areas 5, really still have that same physical distancing component and those face covering guidances that are critical. With our businesses coming back online, they should still maximize use of telework and delivery services, use physical distancing strategies, minimize non-essential travel. Those are really important to be doing at this time. It's important to also remember that the public health emergency rule that governs spacing guidelines in retail establishments, that 2 per 1,000 square feet, 3 per 1,000 square feet for grocery and stores, and then also has some guidance for small businesses of under 1,000 square feet. That remains in place for all businesses across the state, regardless of whether or not they are essential or non-essential as they reopen. And then I think the other thing to reiterate here finally is just the importance for our vulnerable populations, our elderly workers, our individuals with chronic disease that put them at higher risk, to truly remain at home and stay in that shelter in place aspect of things currently. And if you have family members that are at risk and you realize you're going back to work, recognize that you have that you could bring the virus back to those family members and take care about how not to spread it to them in the home. And then finally, our faith-based communities. They often have a high risk population and a special responsibility, I think, for caring for each other and for their communities. And so we really encourage them to continue, and many of them are showing great leadership in this, continue to use alternative ways to worship and connect rather than the traditional worship services. And it's important to have a clear and well thought out plan for how you anticipate moving gradually by stages into more traditional worship and faith-based community activities. Those are just critical as we move forward. So I guess the bottom line there is we are excited about moving back. We want to begin to reopening. Our ability to do that all depends on our ability to do it cautiously and a disciplined approach and collectively moving forward together. So just to reiterate that and make sure that we do that this coming week. Thanks.
All right, thank you both. Next, let's go to West Virginia Superintendent of Schools, Clayton Birch.
Thank you very much. And, it's one of those things where when I got called and we were going to ask about preparing for today, I had good news. And then the governor noted that we have even better news. So let's start with the good news. The good news is we're continuing to feed 1.4 million children each and every week in the state of West Virginia. We have not slowed down one bit. And we've now secured that those meals are going to be available clear to the end of your county's school year. So all the way to the end of May, beginning of June, we're going to continue that. And the better news is with the approval that both the governor and Secretary Crouch mentioned, DHHR has been a wonderful partner along with the National Guard, Commissioner Lenhart with Agriculture, and the entire governor's staff. And to get this joint application through means so much to our families. The families should see information coming through their school system. We're going to be asking the county nutrition directors to be helping with that. But we're looking at a little bit over $300 per card per child to be used during the months of June, July, and August. And that just means so much to the over 231,000 children that are eligible for this. Even though that those cards are going to be made available, it's going to pump about $72 million into West Virginia's economy. Simultaneously, we're going to continue our efforts with General Hoyer and Secretary Crouch in the governor's office to also make sure that we continue a full feeding system through the entire summer until school starts again. We want to make sure that all of our children are taken care of from now till the start of school and hopefully back to some normalcy. Friday was School Lunch Hero Day. We celebrated with the Service Personnel Association and continuing to thank those service personnel out there who are stepping up. It was also School Principals Day on Friday, and we just want to thank the folks who are out there in the school principals. And even though the buildings may be closed, they're working each and every day to continue organizing meals, making sure that remote learning is taking place, and coordinating with teachers. And then I want to thank Secretary Crouch for bringing up Children's Mental Health Awareness Day. You'll hear me continually talk about it, and you've heard the governor and I speak on it, is one caring adult. And I think each and every one of the families and children out there need to know that whether it's be through the meals or the remote learning, we are not letting go of that idea that there is one caring adult looking out for each one of our children. And I believe wholeheartedly in the state of West Virginia, it is a whole lot more than one per child. It is unbelievable the partnerships we've leaned on during this time. So on behalf of the Board of Education, Department of Education, we definitely want to thank our partners and thank the governor for helping us get this organized. Thank you.
All right, thank you. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. I know that people are antsy to get back to normal life and things like that, especially with things slowly reopening today. I wanted to talk a little more in the future. It's not on the 3 to 6 week list, but just about summer activities. People want to be able to plan as much as they can right now. So as far as things like softball, baseball, and other activities like that, what can you tell people right now who are just, I guess, excited for the future at this point?
Okay, Amanda, I think I can answer it, but this is going to be almost a play as we go. We're going to have to continue to monitor the numbers and really watch what's going on as far as sporting events and whatever like that, or movie theaters. We're not ready to move on that as of this time. I hate like crazy. Forever I've been the president of the Beckley Little League, and I got a call not long ago. Said, "Well, what are we going to do? What are we going to do about the Little League? There's almost 1,000 kids, or there has been in the past and everything, and a lot of those kids, to just tell it like it is, don't maybe have other activities to do in the summer because that particular Little League doesn't charge an admission fee, and that's good. and everything. And those kids, some of the kids are the kids that are having the toughest time. And we'd love, to have them and love to be able to do it. But, right now we've got something that's even bigger and tougher that we got to deal with. So I think we just got to continue to watch the numbers, and if the numbers keep going like they're going and everything, hopefully we'll be playing ball and doing some stuff through the course of the summer.
All right, thanks, Amanda. Next, let's go to Steve Adams with Ogden Newspapers.
Steve Adams of Ogden Newspapers here. Back at the end of March, you had talked about a purchase of $575,000 purchase of face masks, 100,000 surgical masks, and that was back at the end of March. And I'm reading a number of news accounts from other states and even the federal government talking about states and federal contracts where they've purchased these masks for well above the unit price that even 3M is saying. So I was curious about whether A, if we already have those masks in place, and B, are we getting better prices as we price these things out now than when we were pricing them back at the end of March? Because even 3M says $575 or whatnot for a mask is price gouging. Thank you,
Stephen. I want General Hoyer to take this because he knows it. He knows this stuff 1,000 times better than I, as far as what's in, what's not in, and everything. But General, if you could.
Yes, sir. So, Stephen, we are seeing pricing changes as this has developed and more supply has been available. We'll be providing some information as to the quantities that we now have available. I will tell you that based on the governor's requirement that we establish a task force early on, we have come from a point of being well behind on surge capability to the point now with the amount of supplies that we have coming in and what we have available. We have projected that we can meet a surge should we need that amount for a surge. We continue to work with the development of our own PPE. Gowns continue to be our current issue of primary issue. And as of today, we start with prison industry, starting to make our own reusable and gowns that can be sanitized and used again. So we continue to make good progress on that front. We're continuing to see prices change in the downward direction. But early on, you are correct. There were a number of organizations that we dealt with that had much higher price rates.
Let me add one thing to that too, Stephen. The initial purchases that we made, they were for our first responders primarily, and those that were right down on the front lines and everything. And we did not have materials, and so, sure, we may have paid too much on a couple of things, in the beginning to be able to protect those people and everything and get them in protective gear and everything. But I'm proud we did it, and so a lot of other states paid numbers like $7, $8 for masks and stuff like that, and so that was just a going thing. We had to jump in, and we jumped in really quick and got it done.
All right, thanks, Steve. Next, let's go to Paul Mullen with WCBC Radio.
Paul Mullen, WCBC Radio. A question about nursing homes, and we've had a lot of infection there and a lot of death there. How many of these patients are dying with advanced directives of not to treat them if they do get critically ill?
Somebody's got to take that one other than I, because I just don't know.
I can.
Wait a minute.
I don't have the exact numbers, but a fair portion of them have had advanced directives already. This is true, and so it's difficult to sort out would they truly have died from COVID-19 or otherwise. But many did have advanced directives.
All right, thanks, Paul. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, you previously said that businesses opening would be given a week's advance notice. You'd be making those announcements on Monday. Could you talk about why you haven't done that today and when that'll actually be made? How long will these businesses for week 3 have to get ready?
Charles, I think all that will be coming out later today. We're going to try to abide by the things that I say. Like I said before, there'll be times that I make a mistake, but I'm not going to tell you anything that I don't believe to be the truth. And so I think all those rest of those guidelines will be coming out later today.
All right, thanks, Charles. We'll go to Kenny Bass next with WCHS.
This is Kenny Bass with Channel 8 and Fox 11. I have a question about campsites and state park facilities. Those were among the last to close with outdoor activities. And a lot of people have been asking about when those campsites will be reopened for public use. And right along lines with that, the governor had issued a 30-day holiday from fishing licenses during the beginning of the pandemic to allow people to go out and leisurely fish. Will that holiday from licenses continue, or will we be back to business as normal as we transition more businesses to open up?
Okay, I think I can answer them both. Kenny, it is my intention. I think the way the U.S. Fish and Wildlife guidelines were that you could only do that for a maximum of 30 days. And then at the end of that 30 days, it was my discussion with Steve McDaniel and everything that what we would try to do is extend for another 30 days to basically try to get people through the trout stocking season and everything, where they're enjoying, our putting, all the trout in the streams and so on. And so, but back to the campsites just one second. If, Kenny, the biggest problem is just one thing, and that is, so many people from out of state, come and enjoy these wonderful, wonderful, mountains and streams and all the beauty of this phenomenal state. And right now, all the people that are around us, especially all those that are within a rock's throw of us, our numbers are nowhere close to as good as ours. And so we want to be a little slower bringing people back, but we're on it and we're watching it like crazy, and I'm very hopeful that we'll have those campsites and everything open back up before long.
All right, thanks, Kenny. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hey, everyone. CDC has put out the excess death reports, and from March 1st through April 11th, it indicates that we've had about 2,100 more deaths than would be typical in that time period, which is about 80% higher than what it should be. Are we underreporting COVID-19 deaths, or is there any number of other factors why we would have this spike in the state's death rate?
Well, Phil, I want to add just one thing. First of all, from my standpoint, I want us to be so transparent and everything that anybody and everybody can see everything that's going on, and I want it to be not complicated numbers to where just all of us can understand the numbers. But I think Kathy and Bill can probably explain that a whole lot better than I can.
Absolutely. We saw that report as well. It was a projection of excess deaths that could have occurred from all causes. And when we saw the numbers, we actually did not think it resonated with the ground truth of what we see in our communities in terms of deaths. We know roughly how many deaths occur each month, et cetera, and that would not ground with that same thing. So we did reach out to the center that put that together to ask about their methodology. They have looked at their methodology again and realized that there was an error in their methodology. And so they have adjusted that methodology and appropriately are going to be reissuing that with cautionary guidance there. What had happened is they incorporate, they compare it to prior years, and West Virginia reported more rapidly in this last year, and they didn't take that into consideration. And so the projections were overestimated. And so they are going to reissue that with the proper methodology, and they're going to note the cautionary guidance around that as well.
I would just say for clarification, Kathy referred to that as the center. It's CDC for those who might not recognize that terminology. Center for Disease Control is correcting that.
All right, thank you, Phil. Next, we'll go to Todd Boucher with WTAP.
I'll try to make my question brief. The Wood County Commission here has been trying to decide what it wants to do with the hero bonus, the $100,000 that was allocated to counties. One of the things it's decided is to use half of that for personal protective equipment for essential workers, but not necessarily confined to people who work for Wood County, such as the health department or the 911 center. They're talking about businesses and their interaction with customers. In your opinion, is that an appropriate use of that money?
Absolutely. And in fact, I think it's admirable. And so, we want the money going, we want the counties to be able to decide. And we surely want to reward our heroes for all that they've done. But at the same time, our heroes know too that we've got to be able to continue to protect as we go forward too. So absolutely, I think it's a good job.
All right, thank you, Todd. We'll go to Brad McElhenney next with West Virginia Metro News.
Hi, Governor. When we last got together, which was on Friday, you mentioned going to a meeting with your revenue advisors around 4 o'clock. I just wanted to know if there was any update on state strategy in dealing with its revenue gap. And I watched, as many people did, the town hall with President Trump last night. He still seems to be expressing reservations about allowing federal dollars to fill these state budget gaps.
Okay, Brad, the meeting was great. The meeting was extremely informative to me, because it really, the meeting the prior day, I was still needing to have more clarity from the standpoint of the mathematics and everything on how it worked. It was really good for me, from the standpoint of where we are and where we're going to go. It's just as simple as this. I do believe that President Trump is reluctant to backfill, states that have had decades of neglect in regard to their pension liabilities and things like that. I am still very, very hopeful that there's going to be some methodology to where we can backfill a loss of revenues just simply because of this terrible pandemic. You got to remember, we're a state that is rock solid, in every way. We were churning out surpluses, and we were absolutely moving and leading the nation and moving in a really, really positive way. This pandemic has chopped our legs off. We don't want to go back and get something that backfills something that was a past sin decades ago. All we're trying to do is backfill the loss that's come from the pandemic. Now, as we go forward and everything, I think this week we'll get a lot of clarity this week as to where we're going to be able to go and everything. But we tried to make contingency plans. If this doesn't work, what do we do about this and this and this and everything? And how do we take care of the counties? How do we take care of the cities? How do we take care of everybody? So there was just a lot of great discussion. The revenue department, that those guys and girls do a great job. So it was a really good meeting.
All right, Governor, I'll turn it back to you.
Well, I don't have too much other than the fact that I've got to run and go to a conference with the vice president. The only thing I try to take notes, from our speakers throughout the briefing and everything. And the only thing I really have that really jumps out at me is just this: is with the new Fed dollars that we've got that now can come in, because this is really close to my heart. We've got, when you just think about 231,000 kids in this in this state that we're feeding, and all kinds of seniors and everything, and you got people going hungry in a state and in this state, and all across our nation, if not all across the world, but we need to really, really always try to be good neighbors. And just the simple fact that Clayton Birch said, that they're going to continue the feeding through the summer, they're going to do all this and everything. They're feeding 1,400,000 meals or whatever, and all. It's just, right along and on and on and on. But the thing that really caught my eyes is just this: with this Fed dollars that are coming in, there's another $72 million, if I remember correctly from what he said earlier. There's another $72 million that's flowing into West Virginia, and it's going to flow in pretty daggum soon. And it's going to flow in for those kids and those families, or those kids primarily, to to have, you know, the opportunity to have a little extra food and everything. And not only that, that's got to be, you know, the multiplier effect of those dollars in our economy is really important. So we're really thankful. And so I guess I'll end in that and just say, again, remember the 3 that we lost today, or we really lost on Friday or Saturday, I don't know which day. And just please take heed to everything that I'm saying. Be safe. For crying out loud, West Virginia, use all the goodness that's got you to here. I mean, why blow it now? I mean, really and truly. Use the good that's got you to here. You absolutely are the miracle of this nation. Do you realize just how good you have done? Just look at the national TV shows that are calling up, wanting to know what's happened in West Virginia. What's happened in West Virginia? You see it all the time. You see the president mention us all the time. Absolutely, you have knocked it so far out of the park, it's unbelievable, but continue down the path. Be safe. Wear a mask. Wash your hands. Keep social distancing. Absolutely, just do the stuff that's smart. You're the smart people, West Virginia. You're the diamond in the rough that everybody missed. Just keep it going. Thank you.